So let's go ahead and get into our first question. So I think we would be remiss if we didn't talk about the fact that there's an historic strike wave right now in the city of Los Angeles. Close to 200,000 workers with SAG-AFTRA, WGA, and Unitarian Local 11 are on strike right now as we speak. And as with many strikes, healthcare is a huge part of the story, right? With the Hollywood strikes, there's a very direct link between the push for fairer streaming residuals and meeting the income for union healthcare, right? Similarly, Unitarian has listed affordable healthcare as one of their top priorities in their fight as well. So we have tens of thousands of hotel workers on strike all across the city of Los Angeles. And a lot of these issues stem from the fact that in the U.S., we tie healthcare to employment. So my first question is, how do you think that union workers and all workers stand to benefit from the passage of CalCare? And I think we'll start with Assemblymember Carrillo. Sure, yes. The question is, how do you think that union workers and all workers stand to benefit from the passage of CalCare?
Thank you for the question. When we look at organized labor, there are various different tiers within organized labor. There are low-wage workers who may or may not have a health plan within their union. There are public sector workers who may have a health care plan. There are firefighter unions which have, in many ways, a Cadillac version of a health care plan because their jobs risk their lives every day in order for them to have access to cancer screenings and other types of screenings that traditionally everyday workers may not have. But at the end of the day, what I love about labor is that labor fights for all workers despite whether they are in a union or not. And that is what we're doing with CalCare. It is an opportunity for every Californian, regardless of economic status, regardless of legal status, regardless of where they come from, to have access to quality health care with dignity in a timely manner. We have done incredible work in the legislature to move forward with access to Medi-Cal for undocumented young people and now undocumented seniors. And that's important. That says a lot about our values. However, we do not have the healthcare workers necessary to actually make that a reality, which I've said in the past, are we creating a false win? Because if we are creating opportunities for everyone to have access to Medi-Cal, which includes union workers, it includes low-wage workers, then if they still have to wait 6 months, 8 months, 9 months to get an appointment, they are still risking their lives, and they are, in case they need a medical emergency or to see a specialist, those specialists may not be available because California's medical reimbursement rates are one of the lowest in the country. So despite having these incredible wins towards providing some kind of more access to healthcare for low-wage workers within unions, we still don't have the workforce necessary to actually provide care. So unions getting involved, regardless of where they come from or what type of work they do, in investing in the future of healthcare for our state, really puts California on the map, and I think at the end of the day provides a future of California where people are healthy, where they're thriving, and where we continue to be the kind of state that shows the rest of the country what is possible.
Thank you very much for the question.
Look, here's the bottom line. Workers are being squeezed, and it's very difficult for them to pay rent, cover the bills, and have basic things like groceries. And so when we're talking about a healthcare fight, and when we're talking about this meaning something for unions, we're talking about one less thing at the table that they have to negotiate. Because that's a big part of it. And so taking healthcare off the table means that there's more dollars in people's pockets. It's one less leverage point for a corporation to be able to negotiate, or an agency to negotiate. So giving healthcare to someone and having a system that works for the health of people, not for the profit of people, changes the game not just for unions, but for people who are out there every single day who may not have a union. And what we're seeing across the country, particularly in California, is people saying enough is enough. I work hard, sometimes have 2 jobs, and I just can't pay the rent. I work hard, sometimes have 2 jobs with 2 people, and you're sleeping in a car between shifts. The ability to have healthcare coverage, we've said this before, is a human right. The ability to have healthcare coverage is one last thing that is negotiated at the bargaining table. So we've got to fight extremely hard, and that's why I think you're seeing more of a coalition getting built around this issue of healthcare, around this issue of single payer, and around the organizing that you're doing now around CalCare. And I think you're going to see a larger movement happen because that dollar that anybody earns is pinched in every single direction. And I think it's incredibly important that it's off the table when it comes to contract negotiations. It ought to be a real right, not just something that you have to fight for and get very basic little when it comes to contract negotiations. So thank you.
Absolutely.
So for going on 5 years now, I've been the chair of the State Assembly Committee on Employment, Labor and Employment. So as Labor Committee Chair, there's no doubt that I strongly support our brothers and sisters in the labor movement. As my colleagues do, I think all of us are pretty strongly support when it comes to issues regarding protecting workers' rights and what have you. In fact, just in the 2 days that I'm here in LA, I'll be meeting with Starbucks workers, going to SAG-AFTRA WGA strike line at Fox Studios. I'll be going to a hotel worker Unite Here strike line. I was just at an SCIA UHW strike line at Kaiser last week. And my staff in San Jose was with fast food workers today. So there's a reason why we're seeing the people rise up. They're seeing all this money being made, productivity increasing, and yet that wealth is being hoarded, and it's not going to the workers. And what we find is, as my colleagues stated, so much of the bargaining, what have you, has to do with healthcare. You know, in fact, I had a call this morning, a Zoom, 45 minutes with New York State Senator Gustavo Rivera. He's introduced in the New York State Senate their single-payer healthcare bill. He said the number one obstacle to getting that through is the public sector unions. And so we have to really have honest conversations with our friends, with our brothers and sisters, because some of their fears are, we have to understand what their fears are. They have bargained and put a lot of time and energy and given up things to have great health care. They created health trust funds that have been built up over decades. We can't just say, well, forget about that, that doesn't mean anything, whatever, stand with us. We gotta say, okay, we get that, and guess what? When we move to CalCare, we're gonna make sure that we account for that. That when these health trust funds get dissolved, they're not just gonna go to the employer. That the worker is going to get their share, not most of it. That we make sure that we recognize that you bargained for these benefits. But I will say this, we can't do anything about things in the past. If someone gave something up to have a lower copay or whatever. But we can certainly say that going forward, they can bargain for a lot more. As Senator Santiago was talking about negotiation, something Sarah Nelson with the flight attendants union says is what we legislate, we don't have to negotiate. And so if it's legislated and it's mandated, whether it's extra sick days, vacation time, bereavement pay, or if it's actually having health care, now you can negotiate for other things. And that's what we have to understand, that there's a legitimate fear from some of our brothers and sisters in the unions, and we have to give space to have these real tough conversations that not only speak to the morality of the issue, but it speaks to the fact that they want to take care of their families too, right? And so I think there's great opportunity with us. I think instinctively, union members, instinctively, to Senator Carrillo's point, they want to do what's in the best interest of everyone. But we have to get them there. And that's why the other thing that's in CalCare that recognizes that the retirees is that there are provisions in CalCare that within 2 years of its enactment, of the passage of the policy bill, they've got to figure out a plan to make sure that retirees that leave the state are also have access to CalCare. Because that was something that was raised to us from retirees. So we are listening, and we just invite more and more of our brothers and sisters in the labor movement to come talk to us about their fears and concerns. because they are legitimate, but I think we can answer them and make sure we can create a bigger tent and get the labor movement behind what is a very righteous cause.